I remember the exact moment this question first hit me. How is it possible that something as simple, as automatic, as routine as brushing your teeth every single day still leaves so many people with cavities, bad breath, and that quiet insecurity when speaking up close with someone? It didn't make sense. Because if effort were the answer, this problem simply wouldn't exist. And yet, every single day, millions of people wake up, walk to the mirror, brush their teeth exactly the way they were taught as kids, and still end up sitting in a dentist's chair hearing the same thing all over again: you have another cavity. Or they walk into an important meeting, a face-to-face conversation, and feel that knot in the chest. That doubt no one says out loud, but everyone has felt at some point. Is my breath okay right now? It's a small question, but it carries enormous weight. Because bad breath isn't just a physical problem. It's social. It interferes with how people present themselves, how they connect with others, how they feel about themselves. And when someone spends years trying to fix this problem without results, something much deeper than their teeth starts to be affected. That's when I started paying close attention. Not to how often people brush, but to how they actually do it. And what I found was unsettling. The problem nobody sees. Most of us aren't failing because we're careless. We're failing because we've been repeating the same silent mistakes for years, without ever questioning them. Think about it. When was the last time someone actually taught you how to brush your teeth? Probably when you were 5 or 6 years old. An adult showed you how to hold the brush, told you to brush up and down, maybe taught you to use floss, and that was it. Subject closed. From that moment on, you repeated that same motion every single day for years, decades even. And at some point, that motion became automatic. You don't think about what you're doing anymore. You turn on the faucet, grab the brush, apply the toothpaste, and start moving your arm while your mind is already somewhere else, thinking about work, about breakfast, about a conversation you need to have. And that's exactly where the problem lives. Because when something becomes automatic, it stops being examined. And what isn't examined isn't improved. So while you believe you're doing the right thing, your body quietly accumulates the result of the small mistakes nobody ever pointed out to you. What I found when I started looking closely. I saw people brushing with force. A lot of force. Fast, aggressive motions, like they were scrubbing a dirty pan. The logic seemed to make sense. The more vigorous, the cleaner. But the dental science shows exactly the opposite. Brushing hard doesn't remove more plaque. On the contrary, it wears down the enamel, which is the outermost and hardest protective layer of your body. Once enamel is destroyed, it doesn't regenerate. And without it, teeth become exposed, sensitive to hot and cold, more vulnerable to cavities, and progressively more yellow in appearance. I saw people finishing brushing in under 30 seconds. 20 seconds, sometimes. The freshness sensation that toothpaste creates produces an illusion of cleanliness, but the tooth has been nowhere near adequately treated in that amount of time. I saw people who never cleaned their tongue. Ever. For them, brushing their teeth and taking care of their breath were the same thing. But they're not. The tongue is one of the primary reservoirs of odor-causing bacteria in the entire mouth. Ignoring the tongue is like washing half the dishes and putting everything back in the cabinet. And I saw, repeatedly, something I consider one of the most underestimated mistakes of all: people brushing immediately after eating. It seems hygienic. It seems responsible. It seems like the right thing to do. But it isn't. The mistake that looks right. When you eat or drink something, especially something acidic, like fruit juice, soda, coffee, or even certain fruits, the pH in your mouth drops. The environment becomes more acidic. And at that moment, the enamel on your teeth is temporarily softened. If you brush your teeth right now, even gently, you're abrading enamel that hasn't had time to recover. You're literally scraping the protective layer of your teeth at the moment it's most vulnerable. What modern dentistry recommends is waiting between 30 minutes to an hour after meals before brushing. During that time, saliva neutralizes the acid and enamel naturally remineralizes. You know what you can do during that window? Drink water. Rinse with water. Chew sugar-free gum. These actions help accelerate pH neutralization and protect your teeth while you wait for the right moment to brush. But that's just one of the mistakes. And it's far from the only one. The technique you've probably never used. Most people brush their teeth with horizontal movements. A back-and-forth motion from left to right, repeated with force, covering the front surface of the teeth. That seems logical. It seems efficient. But there's a problem. Bacterial plaque doesn't just accumulate on the flat surface of the teeth. It accumulates at the gum line, the delicate space where the tooth meets the soft tissue. And that space, with horizontal movements, is almost never reached. The technique recommended by most modern dental guidelines is called the modified base technique. The name is technical, but the concept is simple. You position the brush at a 45-degree angle toward the gum line, not parallel to the tooth, but tilted in the direction of the space between the tooth and the gum. Then, instead of long horizontal movements, you perform small vibratory and circular motions, working on groups of 2 or 3 teeth at a time before moving to the next area. This technique does two things simultaneously. It removes plaque from the tooth surface and gently dislodges bacteria that have already begun to infiltrate the gum line. It's completely different from what most people do. And the results are too. The time you're not spending. 2 minutes. That's the minimum recommended time for an effective brushing. 2 minutes sounds like nothing when you say it like that, but in practice, for most people, it's double or triple the time they actually spend brushing. Studies conducted with groups of volunteers using electric toothbrushes with built-in timers showed that the average brushing time is approximately 45 seconds. Less than half the minimum needed. And the worst part, when those same people were asked how long they thought they had brushed, most estimated between 1.5 minutes and 2 minutes. The perception was completely distorted. The clean feeling that toothpaste creates fools the brain. The foam, the flavor, the freshness, all of it signals done before the real work has even been completed. A simple way to fix this: use a timer. It can be your phone, a 2-minute song, anything that tracks time objectively. In the first few days, you'll be surprised how long 2 minutes feels when you're actually paying attention to what you're doing. The sequence nobody taught you. There's an ideal order for oral hygiene. And most people do it in a completely random way, or worse, in a sequence that reduces the effectiveness of the entire process. Let's start with floss. Flossing should come before brushing, not after. When you floss first, you dislodge the debris and bacteria sitting in the spaces between your teeth, places the brush simply cannot reach. Then, when you brush, you remove what the floss just mobilized, along with the plaque on the tooth surface. If you floss after brushing, you're respreading bacteria onto a surface you just cleaned. After flossing comes brushing. 2 full minutes with the correct technique. After brushing comes tongue cleaning. The tongue has an irregular, porous surface that functions as a perfect shelter for anaerobic bacteria, the same ones responsible for the vast majority of bad breath. Cleaning the tongue with a dedicated tongue scraper, or, in the absence of one, with the brush itself using gentle front-to-back strokes, is one of the most effective gestures for sustainably controlling oral odor. And last, mouthwash. But here there's a critical detail that almost nobody knows. The mouthwash mistake that's canceling your brushing. Many people rinse with water right after brushing. It seems hygienic. It seems necessary. After all, you want to get the foam out of your mouth. But by doing that, you're literally washing away the fluoride that the toothpaste just deposited on your teeth. Fluoride needs time in contact with the enamel to work. It integrates into the tooth structure, reinforces the protective layer, and helps remineralize microlesions before they become visible cavities. That process doesn't happen in seconds. It needs a few minutes of contact. When you rinse with water immediately after brushing, you interrupt that process entirely. What experts recommend today: After brushing, spit out the excess toothpaste, but don't rinse with water. If you want to use a fluoride mouthwash, use it at a different time of day, not immediately after brushing. If the mouthwash is fluoride-free, it can be used right after, but even then, a 20-minute gap is better. It seems like a small detail, but over months and years, this difference accumulates in a significant way. The teeth you're forgetting. There's a region that appears consistently in studies as the most neglected during brushing: the outer surface of the back teeth, especially on the lower arch. The last molars. The ones farthest back, hardest to reach. The brush enters awkwardly, the angle is uncomfortable, and within 5 seconds most people have already given up on that area and moved on. Result: that's exactly where cavities and tartar buildup tend to appear first. Another overlooked spot: the inner face of the teeth, the side facing the tongue and palate. You probably brush the front of your teeth well, because that's what shows in the mirror. But the back surface gets a fraction of the time and attention. And the inner surface of the upper front teeth, that region the brush rarely reaches with normal movements, is frequently ignored entirely. To reach these areas, the trick is holding the brush differently. For the inner upper teeth, you tilt the brush almost vertically with the bristles facing upward, and make gentle sweeping movements from top to bottom. For the inner lower teeth, the same principle, but with the brush inverted. The type of brush you're using. There's a silent war fought on pharmacy shelves between hard, medium, and soft brushes. And for decades, many people have chosen medium or hard, thinking they cleaned better. They don't. A hard or medium brush combined with excessive pressure causes abrasion of the enamel and gum tissue. Over time, the gums recede. They literally pull away from the base of the tooth, exposing the root. This process is called gum recession, and it's irreversible without surgical intervention. The universal recommendation from major dental associations worldwide today is clear: extra soft or soft bristled brushes, with a small head that makes maneuvering in posterior regions easier, and with rounded bristle tips to minimize trauma to the gums. And what about electric toothbrushes? For most people, especially those who struggle to maintain the correct technique or who tend to press too hard, electric toothbrushes offer real advantages. Many models have pressure sensors that warn you when you're pressing too hard, and timers that divide the 2 minutes into 4 30-second quadrants, ensuring you cover the entire mouth evenly. But the tool alone doesn't solve the problem. Even with the best brush in the world, if the technique and sequence are wrong, the results will continue to fall short of what's possible. What bad breath is actually telling you? Much of what we call bad breath doesn't originate in the teeth. It originates in the tongue, the throat, and the digestive tract. The anaerobic bacteria living in the deeper layers of the tongue produce volatile sulfur compounds, gases with an extremely unpleasant smell that are released during speech and breathing. These compounds are responsible for somewhere around 80 to 90% of halitosis cases. The problem is that these gases don't come from the surface of the teeth. Brushing your teeth perfectly, but ignoring the tongue, is like deodorizing a room by spraying perfume on the ceiling when the smell is coming from the floor. Beyond the tongue, the nose and throat can also contribute to bad breath. Chronic sinusitis, postnasal drip, and tonsillitis are conditions frequently associated with persistent halitosis that doesn't improve with oral hygiene alone. Periodontal disease, gum infections, also produces characteristic odors. If you notice a specific smell that doesn't disappear even after a thorough brushing, that could be a sign that gum inflammation is already present and requires professional evaluation. And then there's the hydration factor. Saliva is the mouth's natural cleaning agent. It neutralizes acids, contains antibacterial enzymes, and keeps the oral environment balanced. When the mouth dries out, whether from mouth breathing, certain medications, or simply insufficient water intake, bacteria proliferate without control. Drinking water throughout the day isn't just good for the body. It's essential for oral health. The floss you're using wrong. About 40% of your tooth surfaces are interproximal surfaces, the sides of teeth that are in contact with one another. The brush doesn't reach those surfaces. No brush does. Dental floss exists for exactly that reason. But even among people who use floss, most use it in a way that minimizes its effectiveness. The most common mistake is simply sliding the floss down between the teeth and pulling it back up. That removes something, but it doesn't do the complete job. The correct technique involves curving the floss around each tooth in a C-shape, embracing the tooth laterally, and moving the floss up and down against the tooth surface, going slightly below the gum line. You do this on both sides of the interdental space. For each space, you use a clean section of floss. This process takes more time, but it's the difference between passing floss and actually cleaning with floss. For those who struggle with conventional floss, people with braces, dental bridges, or joint conditions that limit hand movements, floss picks and water flossers are effective alternatives that make the process far more accessible. Why you keep getting cavities even when you do everything right. Sometimes, even with frequent brushing and flossing, cavities appear. When that happens, there's usually a technical explanation. The first possibility: sugar consumption frequency. It's not so much the amount of sugar you consume, but how frequently you consume it throughout the day. Every time you eat sugar, the bacteria in your mouth metabolize it and produce acid. That acid attacks the enamel for about 20 to 30 minutes afterward. If you drink a soda or eat a sugary fruit once a day, your enamel goes through one cycle of attack followed by recovery. If you snack on sugar all day long, sweetened drinks sipped constantly, candy, cookies, your enamel stays in a constant state of attack with no sufficient time to remineralize. Over time, the result is inevitable. The second possibility: your toothpaste may not have enough fluoride. Natural or organic toothpastes often contain no fluoride at all. Fluoride, despite all the controversy that sometimes surrounds it online, remains the most studied and proven anti-cavity agent in the history of dentistry. The third possibility: you have deep grooves in your back teeth, the natural fissures on the surface of molars where plaque accumulates and where the brush frequently can't penetrate. For these people, the application of dental sealants by a dentist can be an important additional layer of protection. And the fourth possibility: you simply don't visit the dentist frequently enough. A professional cleaning every 6 months removes accumulated tartar, the mineralized deposit of plaque that the home brush cannot eliminate, and allows for early detection of problems that, when treated early, cost far less time, money, and health. What changes when you do it right? When you start applying the right changes: proper technique, sufficient time, correct sequence, attention to the tongue, respect for post-meal timing, well-executed flossing, something shifts quickly. Within a few days, the gums stop bleeding when you floss. That bleeding, which many people accept as normal, is actually a sign of gum inflammation, early-stage gingivitis. With correct and consistent hygiene, that bleeding disappears within 1 to 2 weeks in most cases. Within a few days, the breath starts to change. Not because you're using a different product, but because the oral environment has changed. Fewer bacteria, fewer sulfur compounds, less odor. Within weeks, you start to feel a difference in the texture of your teeth. A cleanliness that goes beyond what you knew as clean. And over months, the results show up at your checkups. Fewer cavities. Less need for deep cleaning. Less visible plaque. But the impact goes beyond the teeth. There is an established relationship between oral health and systemic health that modern medicine took decades to take seriously, but which today is extensively documented. Periodontal disease is associated with a higher risk of cardiovascular disease, worsening of diabetes, complications during pregnancy, and according to more recent research, inflammatory markers linked to neurodegenerative diseases. The mouth isn't an island in the body. It's a gateway. What nobody ever told you about oral health. There's a pattern that appears repeatedly when you observe closely why so many people struggle to maintain oral health throughout their lives. It's not lack of motivation. It's not laziness. It's that nobody ever made the process concrete and real enough. The guidance we receive is vague: brush well, use floss, go to the dentist. But brush well means nothing without context. Without a specific technique, a defined time, a clear sequence, an understanding of the why behind every step. When people understand the reason for each part of the process, when they understand what floss is reaching that the brush can't, what happens to enamel when you brush right after eating, why the tongue needs to be cleaned, why 2 minutes matter, behavior actually changes. Not because you were disciplined enough, but because you finally understood what was at stake. And that understanding is exactly what disrupts the automatic. It's what transforms an empty gesture, repeated out of inertia every morning, into a conscious act of care for something you're going to use for the rest of your life. That's exactly why we left, in the first link in the description and in the pinned comment, a practical and straightforward guide, so you can clearly see what you might be doing wrong and how to fix it step by step. Because once you understand what's really happening inside your mouth, you can't unsee it. And beyond smiling without hiding, beyond speaking up close without that knot in your chest, beyond saving money on treatments and procedures, you start to understand that taking care of your teeth isn't a chore. It's an investment. In your body, in your health, in your presence in the world. If this content made you rethink even one habit you've been repeating on autopilot for years, then like the video and subscribe to the channel. Because there are other habits just like this one, things you do every day without questioning, things that feel right, but that are costing you more than you realize. And once you start seeing those patterns, everything changes.